UHCCP.
This meeting is being recorded.
And so sometimes it can be confusing. So just to level set, United Health Group is our parent company. So United Health Group is a healthcare and well-being company, really trying to build that modern and high-performing health system through different access, affordability, and outcome experiences. So the overall mission of our company is to help people live healthier lives and to help make the health system work better for everyone. And then our vision is to really just make sure that we're delivering the most affordable coverage for consumers, have a very simple experience navigating this complicated healthcare world, and then have very high quality and supported care. And then our core values: integrity, compassion, relationships, innovation, and performance. And so United Health Group, as mentioned, is our parent company. And then you have United Healthcare and Optum. So United Healthcare offers a full spectrum of the healthcare benefits. So we have divisions that are Medicare and retirement. So that's referred to as M&R. Then you have community and state, CNS, employer and individual, and then our global. We are a global company. And then we have our Optum company as well, which is the business that's really delivering it's our tech and data side of the house. And then under United Healthcare, you have community and state is one of those divisions. And that's what Dr. DeLoof and I work personally. We are employees of the Michigan Community Plan. So these are the individual states and that are providing care to really your Medicaid and Medicare members, dual SNP population. So these are the members that are really economically disadvantaged, medically underserved, and don't have the benefit of having those employer-funded healthcare coverage. So you can see here that we've got 100 plus state specific programs. We're spanning over 31 states, and we do serve quite a few members. A lot of members we're able to touch. And so really, if we're thinking about just the community and state perspective, so that underserved population, what is our role in healthcare in America? So really, there within community and state of that underserved population, there are different populations within there. So there are temporary assistance for needy families, which they refer to as TANF. There's Children's Health Insurance Plan, CHIP, age blind and disabled, the childless adults. Then there's also groups of long-term services and supports, special needs plans, dual eligible, Medicare, Medicaid. So this is all, there's so many different populations is really the underlying theme here. And these really are the individuals who need the most assistance within our populations. And you can see here, really just again, our mission is to make sure that we're helping individuals serve better, healthier lives, and to really be the plan of choice that individuals want to elect United as their healthcare provider. And our core values, just some illustration here of them, of some of our relationships and innovation. We have partnerships. You'll see probably a familiar symbol to you all, Sesame Street. We have a partnership with Sesame Street we work closely with, and just a number of other organizations such as NCQA for accreditation as well. And we wanted to take some time to get to know us. And so why is this so important? Because we are going to be helping you all throughout this process, offering, we'll talk about it a little bit more, about offering office hours, and then throughout the timeline, have some opportunity for mentorship. So we wanted to make sure that we could spend some time so you all understand who we are within the company. And Mike Curry's unable to join us today, but he is our Senior Vice President and Chief Health Equity Officer. So he has actually been with United since June of 2010. And he's really responsible for development and execution of our enterprise efforts as a whole, with different initiatives and interventions, really to make sure we're identifying health disparities and then enhancing existing programs or implementing those programs where needed, and making sure that everything's aligned to identify health disparities. He has, in his experience, held roles both publicly and in private sectors. So he's worked with disease prevention, wellness and health benefits, and then 30 years focused on population health management. So he's worked on numerous health equity and health disparity related articles, publications, podcasts, and been a guest lecturer for various academic institutions. So he is really our leader when it comes to health equity and driving our organization. Then we have Dr. Nicole Cooper. And Nicole, are you on the line today?
Good morning, everyone. Yes, I'm on, and apologies that my camera is not working this morning. So I'm off camera, but listening intently, and excited to be supporting this initiative. One, because I know of the national model for training medical professionals that Wayne State University has set. I know of how diverse and rich your university is. And secondly, because I used to live in Michigan, I got my MPH down the road in Ann Arbor, and I'm very excited about supporting this type of unique partnership. And hopefully we will be able to do more partnerships like this, both locally and nationally. So Emily, I don't know if I'm fine with you telling the team about me. You're on a roll there. So I don't know if you want me to fully introduce myself.
You can fully introduce yourself. I think you know it better than anyone else.
Sure, happy to. So really quite briefly, I have been with United Health Group for just about 6 years. I started in our community and state Medicaid health plan, working nationally within the same side of the company, if you will, where Emily and Dr. Duluth work, as she mentioned. And I then, when I came to the company, I was working on national social determinants of health programs focused on bringing more access to social services to our most vulnerable Medicaid members across the country. After that role, I had the opportunity to lead and found really the National Office of Corporate Social Responsibility for UnitedHealthcare, where I led corporate philanthropic grant making, employee volunteer programs, and broader community engagement programs and initiatives focused on health equity. I actually then left the company to go lead the Lyft healthcare business. And that was an interesting ride, pun intended, and really studying and advancing access to medical transportation in particular, working for Lyft. And then I returned to United Health Group, and I'm now in a role where I help lead national health equity partnerships within the Office of Health Equity alongside Mike Curry, who was just described. So very excited about this particular initiative and hearing and really learning much more about what you all are doing on the ground from the various proposals that are received for this challenge.
Thank you so much. And then I'll turn it over to Dr. Duluth to introduce herself, and then I'll go after her, and then we'll have one more individual share.
Hi, good morning, everyone. My name's Patty Duluth, and I'm the Chief Medical Officer for UnitedHealthcare Community Plan for the state of Michigan. So I oversee the Medicaid product, which Emily spoke to previously. I'm I'm a graduate of Wayne State University. I received my undergrad, graduate, and medical degree there at the time when it was known as the Tartars, but I guess we moved on to the Warriors, so I'm aging myself. I also have my master's degree in medical management from Carnegie Mellon, and my specialty is internal medicine with a focus in hospital medicine, wherein I practiced clinically for 20 some years and became involved with administrative work as chair for the Department of Internal Medicine and a focus upon quality, where I was appointed patient safety quality officer for the Beaumont Health System, and then kind of moved directions and started my work on the insurance side with another large Medicaid plan in the state of Michigan, and then ultimately moving over to United for the past 4 years and serving in this role. I work very closely with Emily, our population health director, and that is part of my work, as well as addressing social determinants of health, utilization management, developing physician and community-based relationships, as well as ensuring quality performance for the plan. I welcome the opportunity to work with each of you as a possible mentor, and look forward to what great ideas you may have as part of the challenge. So thanks, everyone.
Thanks, Patty. And then I've been chatting with you all morning so far. So my name's Emily Williams, Population Health Director for the Michigan Plan. I live locally here in Troy, Michigan, so not too far from probably many of you. And I actually went to Michigan State, so go green, for both my undergrad and my master's of public health degree. And so I've always had a focus on really social determinants of health, really before it was called social determinants of health, or really heavily referred to that. But that's the majority of the work that I'm doing, is really looking at it from a health equity perspective, looking at different disparities, and looking at different programs that we can implement to help better serve our members, and really thinking from an innovation standpoint of how can we better serve individuals who have traditionally received social services, and what makes it unique that individuals have not received those social services that have been made available to them, and how can we tailor them a little bit better. So a lot of innovation. We have a housing program that I help lead, along with a food as medicine intervention for type 2 diabetics, and then also work with different community-based organizations to help address different social risks and needs. So one example of that is working with the Detroit Public Housing Authority, along with an FQHC and a community-based organization, where we are implementing a program called Passport to Health, to really focus on the single head of household women that reside in the public housing agency units, and make sure that their physical and mental health needs are being addressed, and making sure that they are aware of services available to them, and making it fun as well to engage in the services. So prior to joining United, I was involved with some other companies, and really had an opportunity to work more closely on the innovation IT side with case management and utilization management. And then in my free time, just really enjoy spending time with my kids, and watching some MSU football and traveling. So that's a little bit about me. And then I'm going to turn it over to Dr. Kenny Poole.
All right. Can you guys hear me okay?
We can.
Okay, perfect. Kenneth Poole. I've been with United Health Group for about a year. I'm an internal medicine physician by medical training. Went to, I guess we got some Big Ten themes going. So I went to med school at Northwestern, and then trained in internal medicine, and practiced as a private practice physician in St. Louis, which is my hometown. Did that for several years, got an MBA at WashU. So I was interested in kind of systems healthcare, more so from a corporate perspective. And then joined Mayo Clinic, who I was with for roughly 8 years before coming to United Health Group. So at Mayo, I practiced academic internal medicine, and then also oversaw patient experience for Mayo Clinic's Arizona campus. And so that's kind of, one of my business expertise or special interest, if you will, is consumer user experience within the healthcare space. I also worked as a clinical informaticist within Mayo Clinic, and so also well-versed in most things digital related and clinical information systems, again, within the healthcare space. So did that, and then came over to UHG to work on the Optum side last summer, and oversaw patient and provider experience for Optum Care and then Optum Health for the first 6 to 9 months respectively of my tenure, and then have recently moved to the United Health Group level. So I know again, the layers of UHG were explained, where I look at physician experience across the UHG enterprise. So not only our care delivery clinicians within Optum, but also our clinicians that sit elsewhere within our organization, the United Healthcare side, those that are doing utilization management, and those that are kind of playing on both sides of the aisle related to our various businesses. And so really excited about interacting with the group.
Thanks so much. So that's a little bit about all of us who you will see throughout this journey with the challenge in terms of mentorship, being available for office hours throughout the month of October. So we really look forward to talking with you all. So now let's get into what is this health equity challenge? What is the goal? So really our goal is to have new and innovative approaches to support health equity, reduce differences in both physical and mental health based upon, it can be race, language, culture, gender, and/or sexual orientation within the state of Michigan. And we'd really like for individuals to propose how the idea would be sustainable long-term as well. I think that's been a challenge in and of itself with a lot of different approaches, is how could we come up with an idea, but make sure it's sustainable? Would it be something where it requires a policy change? Different partners in the community that would be able to help with their support? Or is it a pay for success model? Continuation, or as simple as, continuing a challenge-like model within Wayne State. So endless possibilities, and really looking forward to what you all come up with. And then really, this is an opportunity to partner with community-based organizations on your approach. So you can either utilize your existing relationships that you may have in the community or currently working with on projects right now. Or if you have an idea and you're a little bit stuck and maybe need some introductions to an organization, UHC may be able to help out there. And so during those office hours, if you come there and have a need, we'd love to try to help facilitate some introductions or help from a relationship building standpoint if we can be of help. And then some examples of themes. So this is certainly just examples, not limited to just these two ideas, but one is giving all kids a healthy start. So that's really important to us here, is making sure that we're improving the health for mothers and babies, reducing differences or disparities in the health outcomes. So you can think of maybe low birth weight impact or prenatal nutrition, all different ideas that are out there. Reducing lead exposure for children, and then overall improving the health and well-being of the children and families served by child welfare system as well. Another example of a theme would be really serving the whole person. So this is coordinating the different types of health services, which can be very challenging, which is the physical and mental health care is traditionally what is thought of throughout those different types, but it also incorporates dental care, long-term care, and different supportive services to make it easier to access and more effective. And then also providing support for things beyond health services. So this could be nutrition, safe housing. So these are really our SDOH buckets, if you will. Education, employment, there's different possibilities there. And then also reducing opioid and/or drug-related deaths. So those are just some examples of themes that you could explore further. Then we'll get into the highlights of the application itself. So some of the criteria. And so for this challenge, it is Michigan specific. So we'd like for you to share where your proposal would potentially be, and also the setting. So you could say it's going to be in Wayne, Oakland, Macomb County, or just Wayne County, or City of Detroit, or the west side of Michigan. And perhaps it's a school-based program, or it could be a residential program. Really, it's it's on the application, so you'll see it there, and that's just kind of what we mean by where it would occur. And then also the most important is making sure that we're focusing on reducing racial and ethnic disparities, and that it's a new and innovative approach. And mentioned it can be either race, language, culture, gender, or sexual orientation. We'd like you all to utilize some public data. Within our application, we have a whole page of links that are made available for you all just to help inform some decision making and supporting the intervention. But certainly our list is not limiting to only utilizing that. You can use whatever public data that you do find. And then proposing, as we talked about, the sustainability of the model, and then articulating how the proposal will utilize the $50,000 with the community-based organization. And some pre-application support. So UHC will offer some office hours for anyone to attend. These will be taking place on Wednesdays in October from 4 to 5 p.m. Eastern Time virtually, and a link will be distributed. And then SciPol Detroit did mention that they will be offering some additional office hours as well, just to discuss some ideas, and if there's individuals who may have similar ideas, an opportunity to group individuals together. Because one thing I may not have mentioned is you're able to submit your application individually or as a group as well. And then here's the award model. So there will be up to 10 groups that will be considered honorable mention. And all of these groups will be awarded $2,500 based upon that initial application. And then we will be selecting finalists. And so there will be an additional 5 finalists. So those are outside of the honorable mention group, will be selected to receive a $5,000 stipend. And then you'll be paired up with a mentor to help fully support you and bounce ideas off of throughout this project proposal, along with potentially identifying a community partner to help you out with from the CBO side of things. And then we'll have challenge winners. So at the end of the project, an independent review committee will be reviewing the final proposals. There will be 2 winning groups that are announced, and their selected community organization will receive $50,000 each to implement the proposal. And then those 2 winning groups also will receive an additional $5,000 just to continue the documentation of the impact and the project's implementation. And so now that's really all the information I have about the challenge. We're really excited about it, and I'm really looking forward to see what our some of the submissions are going to be. So I wanted to open it up and see if there's any questions.
I can start. More of a thank you than a question, but first, thank you so much, Emily, and everyone from United Health Group. This is an amazing opportunity. Very rarely do students actually have the opportunity to get money to do something like this as well. So I know that's a really big benefit for students who are strapped for time and cash, and just this excellent mentorship opportunity. I guess I do have one question. Would you mind providing maybe 1 or 2 examples from prior health equity challenges like this, just so they can understand kind of the scope? That may be helpful for us.
Yeah, I think we could provide something to you all, so it's a little bit more comprehensive. Send it to you via email as well. So it really ranges. Some health equity challenges have really focused on, for example, low birth weight, and focusing on low birth weight for specific zip codes within the African American population. So for example, I believe it's 4 or 5 zip codes within the city of Detroit has been shown to have low birth outcomes. So the birth weight of the child has been considered low. And so trying to address that, and so it could be addressed through prenatal nutrition boxes was one of the solutions in helping from a prenatal standpoint of the nutrition, partnering with gleaners to get the food boxes to mom during her prenatal time. And then also connecting prior to delivery with an organization called Black Mothers Breastfeeding to really offer some education and support from a community perspective. So really giving mom that space to connect with other women, answering questions about that things that she may not talk to her provider about. Maybe it's challenges in really trying to adjust and wrap her mind around becoming a mother, or talking about the stress of having a child and everything that comes with it. So that was a safe space there. So that's an example there of the low birth weight initiatives that could potentially be. There are some others out there about the LGBTQ plus population and looking at how it impacts with foster care as well, and seeing how can some support, some wraparound services be provided. So there's some organizations out there where they do provide some behavioral health support, some mental health support to individuals, and really provide a sense of community and well-being as well. And they also provide some other social services. So that's another example of really you could drill down to see where is there a need based upon some public data of maybe it's the LGBTQ plus population. Or we know in Michigan, there's a large Arabic speaking population. And so is there a need there to address perhaps the women in that population, or is it the children and or both based upon certain disease states? So those are just some examples. I hope that was a little bit helpful, Hillary.
Absolutely. Thank you so much.
Yep, you're welcome.
Emily, we also have a question in the chat. Someone is asking, where can we download the RFP for this opportunity?
Absolutely. Wonderful question. So it was actually something, Katie, I was going to see if I can send you guys the application, and let me see if I can share. I've got it up here so you all can see what it looks like. One second. Because I did try to get it up on our website, but we require a lot of different approvals. So it was a little bit slow to get that part going for us. So this is what the application actually looks like. So you're able to complete it online. And so Katie, I will send this out to you for distribution if you don't mind. And so the fields do adjust in case you need to type more, it should adjust for you. And then we did put here affiliation, just so we understand, who some of the cohorts are that are applying with us today, since this is an open opportunity. And then team summary, just kind of explaining who you all are if you're a group. And then also, what are you addressing, the elements, everything that we talked about. And if for some reason you do run out of space, we did try to make this so you could type and it would move along. If you happen to run out of space, please just add a Word document and explain what section you are writing that for, and we will accept it that way as well. So in short, Katie, I think what we'll do is I'll send you the application, and then if you guys want to post it up on your website, certainly open to that.
Yes, yep. We are definitely going to be sharing this on our website. And I believe everyone that's in this meeting today will also be sending out a follow-up email with just some of the resources, including the recording of today's meeting, as well as how they can access our website to start the application process. So yes, we'll have that up.
Wonderful. Thank you. And then this is our flyer that we will also send over to you. So there's a flyer about it, very high level. And one thing that I realized I didn't really touch upon that you probably all want to know is, what is the timeline here? And so here's the timeline. Let me zoom in a little bit more for you. So applications will open on October 1st. And throughout the month of October, as mentioned, we'll have those office hours every Wednesday. And then on November 1st, the applications will close. So all submissions are due by November 1st. And then on November 15th is when we will announce those honorable mentions and kind of that first round. And then everyone will be notified. And then beginning November 16th finalists can work on, start working with their mentors and kind of talk about next steps in the process. And we left it a little bit open-ended, knowing that you all have finals and break and things. So just put a tentative on there on January 1st, which we know, you might still be on break. So don't worry about that. But finalists will begin to engage more so with those community-based organizations. This is certainly not limited to. You could start working with those community-based organizations in November as well. So just really continuing that development of the proposal. And then on February 20th, the final proposals will be due. We will set some more criteria, and individuals in that group will have certainly more information and structure around what will be required to submit. And then in early March, we'd love to have an awards ceremony to really recognize the great work that everyone's done and announce the winners of that stipend and plus the $50,000 for that CBO. And then we'd really like some 6-month reporting updates if possible, just to see how the intervention's going and challenges or barriers and potential opportunities for the future. So I hope that answers some questions too, because I'm sure people were kind of wondering what's the timeline here.
Thanks for that, Emily. I do have a few follow-up questions in the chat that I'm going to read out to you in just a moment, but I do have a question myself as well. For these groups that, like, let's say we're collaborating within a small group, does it matter like who's made up within that group? Like, can it be some students as well as faculty or staff at Wayne State, or even like community members within like the local area? Or does it like need to be like student centered or anything like that?
No, we are really flexible and open to what you think would be best, as long as you're able to meet the criteria of really creating an intervention that's addressing and reducing disparities, really, and working with a community-based organization ultimately, as they will get the 50,000. That's the most strict part of the criteria there, and being new and innovative.
Okay, perfect. Because I do know we do have some faculty members who are pretty interested in this as well. And so I didn't want this to come off as this was only an opportunity for students, but also that, faculty and staff are also invited to participate.
Absolutely. We're definitely looking to be inclusive and really flexible, knowing that a lot of different people could have really great ideas. So really just looking for those great ideas.
Perfect. Wonderful. Thank you. We did have a question from one of the people in attendance. They were wondering whether or not you'd be willing to share those workshop days just one more time.
Yep, and I just got to the view so I could see some of the chat questions. So I just put it in there and got to this slide. And then I'll send Katie the link. Are you all able to use Microsoft Teams?
Yes.
You can. Okay, so they will be hosted via, just since we're hosting them, those will be held via Teams. So I will send Katie you the link that can be probably posted up on the website.
Wonderful. Thank you.
Thanks. I'm trying to see if there's any other questions that I may have missed.
Lisa has her hand up. Lisa, do you want to ask her question?
Thank you, Hillary. I'm curious to get some clarification on one of the points that was made in the presentation about using publicly available data. Is it exclusive to that, or can we use data that has been collected from a particular community or neighborhood in order to focus our efforts?
Great question, Lisa. Certainly you can use that data as well. So one of the examples we did put in the list was community health assessments, which kind of does touch upon those neighborhood questions that are done via the surveys, but we are open to really anything that's done. And we trust you all, being in the academic world, that you know what our credible sources to utilize for this proposal.
Thank you.
You're welcome.
I think there's one other question we might not have clarified, which Lisa Todd is asking, can a community organization also apply directly, or would they need to be considered a partner organization?
Technically, they could apply directly. I think it'd be ideal for the stipend standpoint. We've really wanted to focus that on the students and or faculty. So it's not a requirement, but we definitely would like to reward students, faculty that are putting in the time that way. So I'd like for them to partner up with someone at Wayne State if possible, but if not, they're certainly able to partner. Or submit, I should say. I think we got through all the questions. We really appreciate the time and collaboration. This has been a very quick rollout. So I just really want to thank Hillary and Katie and everyone else with the group for their quick collaboration and turnaround time on this. I know the semester is just kicked off, and we kind of approached them really in August, right ahead of the semester beginning, and they've just been so flexible and a great partner. So we're really looking forward to all the submissions and office hours and future collaboration with everybody.
Sorry, I have one more question. Because I have some coworkers, they are not able to attend the meeting. They were wondering, how can we get a recording of this meeting? Is this available somewhere?
Yep, so I think I can hop in here, Jane Lee. So we did post in the chat, if you have access to it, the link to our YouTube channel. Immediately following this meeting, we will have it posted up there. And then I also think we're going to try and follow up with some emails for all of those of you that are in attendance today to just send out that link one more time, as well as any resources that UnitedHealthcare is going to provide to us.
Okay, awesome. Thank you.
Yep. And I just put in the chat too that UHC, I'll be sending out over to Katie the materials shown today. So the presentation, so you have the information a little bit about us as well. The application, we'll send over the flyer, and those are the three big materials to send over to you all. So we'll make sure that everyone is able to receive that. All right, and I think the first interaction that we'll have with most of you is on October 5th. If you all want to join the office hour from 4 to 5 p.m. It will be very informal, so if you have just one question, just pop on in. We really won't have much of an agenda because it'll be a forum for you all to bring your questions and just have a really good discussion. We may not need the whole time, but it's certainly there for anyone who would like to participate there. Not a requirement at all to attend any of the office hours either. So thank you all for your time. Looking forward to it, and have a great weekend.